Good morning, good afternoon, and good evening, depending on from where in the world you're joining us. Welcome to the webinar on the Inclusive Health Access Prize presented by USAID's Office of Health Systems. The purpose of today's webinar is to present background on the Inclusive Health Access Prize competition and to answer some of your questions about the competition. My name is John Hecker. I'm going to be moderating the session today. Let me first take a minute to explain the interactive features of the webinar platform. Some of you may have not used this platform before. You'll see the chat room that's on the lower left corner of your screen, and it's labeled chat. So throughout the webinar, you can type your questions and comments in the chat room, and our speakers will do their best to respond to as many as they can. Please note that we will not be using your audio or video features during this session. You will hear the speakers speak, but otherwise your audio and video will not be accessible. So the way to communicate is through the chat. Now, some of you may have already submitted questions to the email address that has been posted previously, and USAID already has your questions if you submitted those, and they will be answering them immediately after the presentation. So you may want to wait a minute until that part of the session before you submit your questions, but feel free to submit your questions anytime on the chat box. You can also communicate with your other fellow colleagues through the chat box at any time. Just feel free to post a comment or what have you. Also wanted to mention that we are recording the webinar, and it will be accessible within a few days. It'll be posted on the portal that we have. If you've not yet answered the poll questions that you see, please take a minute to do that. We will be closing the poll in 1 minute, and I'll give you just a little bit of more time now to answer the polls. All right, we're going to close the polls now. Now I'd like to briefly introduce our speakers for today. Caroline Lai is a health economist in USAID's Bureau of Global Health's Office of Health Systems. She has over a decade of experience working on health, economics, financing, and systems issues in Africa, the Middle East, and Southeast Asia. Her focus is on researching the socioeconomic impact of national health financing reforms, particularly on poor and vulnerable populations. She has an MA in International Economics from Johns Hopkins and a PhD in Health Economics from the University of Pennsylvania. Tara O'Day is the private sector advisor for the Office of Health Systems in the Bureau for Global Health. She has worked for USAID in various health positions and capacities since 2002 and has served in Bangladesh, Indonesia, Nigeria, and most recently Namibia as a health office director. Prior to joining USAID, she worked for several implementing partners and the United Nations. Tara holds a Master of Public Health from Boston University. Meredith Perry is the design lead for the Catalyst Project, where she supports the Global Development Lab in USAID and other USAID programs pursuing innovation competitions. Meredith has degrees from Claremont McKenna College and the University of California, Berkeley. So just briefly, we were going to be starting with a 15-minute presentation by Caroline, and then we will go into answering some of the questions that have previously been submitted. So Caroline will do that along with Tara and Meredith. And then that'll be followed by answering additional questions that may be posted in the chat. They may also be answering your questions as we go along in the chat room if you posted questions there. And we will finish within the hour. All right, so I'm happy to present our speaker, Caroline Lai, from the Office of Health Systems.
Thank you for that introduction and welcome everybody. So I will be giving an overview of the Inclusive Health Access Prize, walk you through the web platform for applying and answering frequently asked questions. Then at the end, we'll go over the new questions that arise in the chat box. So on April 9th, we announced the Inclusive Health Access Prize. The prize provides $150,000 in prizes to reward private organizations with a track record of demonstrating that they have been able to expand affordable, accountable, accessible, and reliable healthcare to the poor and vulnerable through an approach that works in collaboration with the public sector. We also want to learn about your new ideas to either scale your approach or expand new geographies. We were driven to create the prize to address the critical problem that, despite many years of commitments from national governments and global health partners to improve access to and quality of primary health care, poor and vulnerable populations in low and middle income countries continue to face barriers to accessing quality and primary health care services. In 2019, many low and middle income country health systems remain under-resourced and overburdened, leaving many people without access to quality basic health care services. This is why we are turning to the global health community to seek solutions. We believe that a solution sourced from low and middle income countries can result through partnership with private and civil society, including faith-based and community partners, working in tandem with public health systems. In particular, we are looking for solvers like you who herald from the private sector, including nonprofits, civil society, the commercial sector, small and women-owned businesses, and civil society, who can provide new approaches that break down barriers to accessing health services and optimizing health systems. In turn, a strengthened health system can deliver better health outcomes at lower cost and help counteract the negative effects of poor economic conditions on health. This helps USAID-supported partner countries on their journey towards self-reliance. So what are we looking for? So we've recruited judges from a number of different organizations and areas of expertise, and we'll be asking them to look specifically at 6 criteria. There's also additional detail on our website which explains the relative priorities of each of these criteria. But in summary, what we're looking for is the following. We're looking for approaches that address the needs of poor and vulnerable populations, approaches that integrate both public and private sector entities for improved health access, approaches that have a feasible and well-articulated scale-up or replication plan, approaches that demonstrate success through improved health outcomes by working towards improved accessibility, affordability, replicability, and/or accountability. We're also really interested in creating local ownership, showing that the approach is owned by the people or the groups that are most affected or benefit from it. And we want to see that the approach contributes to multiple health program areas, such as HIV/AIDS, malaria, maternal and child health at the primary care level, and that the approach strengthens multiple core functions of the health system, such as health financing, governance, human resources for health, or medicine. So why do we think you should participate? We are planning to reward up to 6 winning teams. We're looking for solvers who are eager to share their solutions for innovative, privately led approaches with strong scale-up potential. We'll be awarding up to 6 winners at the United Nations General Assembly event in September of 2019, and each will be awarded $25,000 in funding under USAID's Innovation Incentive Award Authority. These awards are issued as funds transfers to bank accounts, and all award monies may be used at the winning team's discretion. One representative from each winning team will represent their team at the UN General Assembly event to showcase their leadership, diversity, and potential in the global health field for other leading stakeholders and donors. We're open to a range of non-traditional competitors. We are open to approaches from individuals, the private commercial sector, small and women-owned businesses, civil society, universities, nonprofits, and community or faith-based organizations with which USAID has not worked directly. Public sector or government entities, excluding universities, are not eligible. We're interested in competitors who will be able to share registration documents in the country to demonstrate their legal status to operate where their approach is taking place. We have an emphasis on a willingness to share learning. All competitors need to be willing to share their experiences and learning to help establish a body of knowledge that can bring about a greater awareness and sustained change in locally driven health systems partnerships, and providing integrated primary care for the poor and most vulnerable. With regard to intellectual property, competitors must clearly mark any confidential or proprietary content. We are interested in preserving your intellectual property, but in order to do so, the competitor needs to make that clear in their application. And we'll be accepting applications only in English. While entries will be decided on the strength of the content, we do encourage that applicants invest in a translation or have someone with strong English skills review their submission. For completeness, we will only accept complete entries via the platform. Incomplete entries and emailed entries will not be accepted. Late entries, of course, will also not be accepted. And then, importantly, applicants must be eligible to receive USAID funds. We will conduct a responsibility determination to ensure that the awards to the winning individuals or organizations meet applicable U.S. laws and policies, including but not limited to regulations administered by the Office of Foreign Assets Control of the U.S. Department of Treasury. We've also shared a link to the OFAC website, including the list of specially designed nationals. Countries have been added and removed from the list on an ongoing basis. So it'll be up to the applicant to review this website. So how do you apply? We've already opened the link, healthaccessprize.org, for you to submit your applications. We will be accepting the applications through June 28th. Now I'll be going through the platform itself and walk you through the different screenshots of the application site. Again, this application page is on healthaccessprize.org. The first thing you'll notice when you go to the website is that there is a red button to apply now, which will take you to the system to create login information to apply. Next is the login to apply page. Once you've clicked the apply here, you'll be able to create a login based on your email address and a password. Once you've created this login information, you will be able to start your application, save your application while it is in progress, and return to it to complete the application. The first step once you have initiated the application process, is to review the eligibility requirements and submit answers to the eligibility questionnaire. The platform will flag when you have incomplete answers and will not let you proceed until you fix them. The slide indicates an example of the type of error warning you would get if there are incomplete answers. Another feature is that you can download the application questions and your answers to allow you to work offline. There is a button in the top right corner of the application page with 3 dots that gives you the option to download the questions and your answers, as well as clear or edit your answers. On the right side of the platform, the website also has a status bar that indicates whether you are in the entry form. The green circles with a check mark represent completed and saved sections. Finally, once you have completed the application, the taskbar will be full, and the button will allow you to click the Review and Submit button. This will then take you to a page that will allow you to review your answers before submitting the application. Once you have submitted the application, you will not be able to recall or withdraw your application. So the next part of my presentation will include a review of the frequently asked questions. We have been collecting those questions on our website and providing answers, as well as links to ways to resolve some common issues about the application. But I will briefly review answers to some of the most common questions we continue to receive. We'll also have an opportunity to answer additional questions during our Q&A session. So please continue to post questions in the chat box. We have been monitoring them, and then we will make sure to address them. If they are not part of this section, we will also specifically address them at the end. So the commonly asked questions are with regard to eligibility, login issues, questions about new projects, and as well as email submissions. So with regard to eligibility, unfortunately, we cannot verify every single eligibility of your every single eligibility question. Two common types of eligibility questions we do receive are with regard to your country's eligibility, as well as your specific eligibility as an organization. I do want to emphasize that we are looking for locally led, inclusive health approaches that are sourced from low and middle income countries. Now, the question of low and middle income countries pops up quite frequently, and we base the eligibility, or what is defined as a low and middle income country, according to the World Bank's definition. And we have shared a link to the World Bank definitions on our FAQ website. So you can also check there, as well as the World Bank, to see whether or not the country you're in qualifies as a low or middle income country. In addition, as I mentioned before, you must be eligible to receive USAID funds based on our OFAC criteria. And again, the website for that is available on our FAQ. Another question we receive is a question about whether or not current USAID contractors are eligible to apply. Even if the USAID contractor is looking to apply for a prize that is not specific to their project that currently receives USAID funding. What we do want to emphasize is that we are looking for new ideas. So past and current USAID implementing partners and contractors are discouraged from competing in this prize. Another question we receive is about whether or not existing small-scale projects that are looking to scale up or brand new projects are eligible to apply. So the Inclusive Health Access Prize is seeking to reward proven successes in expanding access to life-saving care in low and middle income countries. But competitors should have a vision for how they may scale up or replicate their approach. We are not looking for brand new projects that have not been implemented. Another question, we do have some login issues. We understand that that is That is a side effect for some of the accessibility issues that you may have. So we have shared some guidance, some login guidance for those who are experiencing problems with the application platform. We also have supplied an email address, support@smapply.io, where you can email our technical support if you are having some login issues. Oftentimes, these login issues are very specific to the individual experiencing them. And then we have been receiving email submissions, and we want to emphasize that only entries submitted via the online platform will be reviewed. So please do make sure to go to the website, our Health Access Prize, and register for the prize and submit your entry there. So those address our main questions that we've received. I will now thank you for listening to the PowerPoint portion of the presentation, and I will be turning the set of questions over to my colleague Tara O'Day, who will be addressing the questions that we have been receiving through our chat box. So thank you, and over to you, Tara.
Okay, thank you very much, Caroline. I just want to do a quick test on sound. Great. Okay. Thank you again for everybody for joining. A couple of questions that have come in over the last 20 or so minutes regarding, again, availability to apply. And we are not going to comment on each individual circumstance for each applicant. We encourage you to ask yourself whether your approach is locally led, proven success in expanding access to life-saving basic healthcare in low and middle income countries, and that you should have a vision for how that might scale up or replicate in terms of the approach. Caroline also gave some additional information on the application process. We also received another question on funding, USAID funding, and we are looking for novel, locally led approaches. The prize is intended to reward approaches that USAID has not yet seen and has not previously funded. We have another question that came in about reporting requirements for the grant. What will they be and how long is the duration of the grant? This is just to clarify, this is a prize. It is not a grant. There's no duration or reporting requirements. The prize pays for results, and in this case, the result we are looking for is your approach and scale-up or replication plan, which is submitted via the prize process. If you're a winner, you will receive a no strings attached prize to be used at your discretion. We received another question regarding the costs, how much the costs would be to attend the United Nations event for the awardees, and can the awardee designate a representative? The answer to this is that the trip to the UN General Assembly event will be paid for by USAID, and the awardee is eligible or able to designate a representative to attend that event. We have a question about how the ideas and approaches will be shared for missions to adopt in their future programming, or countries to adopt in future programming. An important goal of this prize is to increase visibility across USAID, including missions, of proven, exciting approaches for additional support and integration into programming. We do understand that there are some ideas that will be novel and intellectual property, so this will be part of a process of determining what is allowable to replicate and what the organization that's won the prize is willing to share. There's a question about the geographical region that is not eligible, requesting if there's a geographical region that's not eligible to apply. At the present, there's no region that is excluded, but prior to the award, we will verify the organizations in that area are eligible. The intention of the prize is to identify and reward approaches led by organizations in lower and middle income countries. And while the Treasury Department's Office of Foreign Asset Control, OFAC, restrictions are evolving, we're not right now noting and foreclosing anyone to apply right now. The next question is, if the business is partially a woman-owned business instead of 100% women-owned, does this affect judging? This will not affect or influence the judging. Another question came about bidding. Can a bid be submitted for more than one country? And if so, will an award be granted for each country? USAID is seeking to make awards based on individual applications, not on a country basis. And we're looking for local solutions. We have another question about a team submitting multiple proposals for a same city in the same organization. And the answer is that teams, yes, they can submit up to 3 applications. Each application will be considered separately on its own merit. And the last question I think I see is, do the organizations have to be registered with Duns Bradstreet? And the prize do not require a Duns and Bradstreet number. You can just take a moment and see if anything more is coming in. Okay, there's also a question on locally led. Does this mean the team leader is locally led, or I guess a local individual, or does it mean the majority of implementation is locally led? Locally led means the approach is homegrown. It means it originated locally and is delivered by local staff. I think that is all we have right now for questions.
So I see a couple of more questions, and I don't know, maybe they're coming into late to you, Tara. So Bob asked, can an organization's entire health system intervention be rewarded, or does submission need to focus on a specific project?
So one of the main things that we're looking for is that the intervention, whatever it may be, is able to improve access to health services, primary health services for most vulnerable. If that is able to be represented, there's data for that. If the approach is, you're able to articulate the approach and show the link, then that is something that could be. We're looking for, though, that there's an approach. It's it's specific enough to let us show that to let us understand that there is a link between the activity, the intervention, and the impact or result.
Okay, and then Kavita asked, if we have the project in more than 2 countries, do we apply for each country or as a multi-country project? Which approach is recommended?
I believe we're recommending one country at a time. The way we're presenting it is a locally grown intervention. And so if it's been modified or if it's been replicated in another place with, again, proven results, they could be submitted separately because we assume that the methodology or the intervention would look somewhat different.
Okay, and then we have a question from Vincent. Does it have to be a public-private partnership? What if it is only NGOs?
NGOs are encouraged to apply separate on their own, but what we're looking for is an approach that shows how the public sector and the private sector are working together in a coordinated and collaborative way in order to achieve an improved health outcomes and access to greater primary health care.
Okay, and then we have another question about woman-owned. Does the organization have to be woman-owned?
No, it does not.
Okay, if there are any other questions, now would be a good time to post them. Hopefully this has been very informative. we've got a couple of other people typing in questions. We've got a question. Training could be part of the project, or does it have to focus on primary health care services? So can training be a component, or does it need to focus on services exclusively?
What we are looking for are innovative ways to improve access to services, and that could be products, it could be approaches, it could be services, it could be looking at the type or quality of services. There are many things it could be. We are not limiting our prize process to any one thing. We're open to novel and new ways of working in order to improve the access to primary health care.
Great. And then we've got another question. If an organization is working in 4 countries, do they need to submit 4 applications? So 1 application for each country, or can they just submit 1 application for everything?
We are looking for locally led approaches, so that would mean on a country-by-country basis, since we would expect that approach to look somewhat different in different contexts. There's also a limit of 3 applications per organization.
And then Chander asks, what are the expectations for a winning organization to share knowledge post-award?
The prize comes without strings attached. Where we're looking for are organizations and interventions or innovative approaches that entities are willing to share because they are proven and because they improve access to primary health care, which saves lives. In terms of requirements to share post-award, we do not have any requirements. This is a prize, again, without strings attached. And our intention is to be promoting organizations that are willing to share their messages and information with others in order to improve the quality of life.
Okay, then we've got a question about the MOU or Memorandum of Understanding. How involved or detailed does it need to be? Is a letter sufficient to show collaboration with partners? So how detailed do you need to get into the MOU?
A letter would be sufficient to show collaboration with partners. And also, just to go back to the expectations of sharing knowledge, USAID would like to profile the organizations that are winning in public fora, such as the UN General Assembly. So there is an aspect of engagement at that point of time when the award is being given.
Okay, and then we've got a couple other questions about the application. So here's an organization working in different states in one country. Do they need to submit separate applications if they're working in different states in one country?
If the applicant is replicating the same intervention or service in different states and has data, that could be a good example of showing replication and a data point for showing success to prove the value or validity of that intervention. So no, if it's the same intervention, 1 application could cover.
Okay, and a question about, so an organization can submit up to 3 different applications. Are these 3 different activities? So if you're submitting different applications, do they need to be different activities, if I'm understanding the question?
yes, if there are different activities, yes. If it's in a different country, the same organization in a different country, again, we would ask to go back to the eligibility question. If it is a locally grown, locally led solution, and if it is being replicated in other countries, if it's something different, if there's a different component to that activity in the other country, that would be a different application.
Okay. So that's the last question we have posted right now. Here's another one. Can we submit, again on the applications, can we submit 3 applications with the same activity described differently? Not sure I completely understand that question.
I would need more information on that to be able to respond to it.
And can you submit an application for an ongoing project, or does it need to be a totally new project?
We are looking for existing ongoing projects. We're not looking to, we are looking for that are proven in terms of their results. So we're not looking to award for ideas or concepts that have not yet been tested. So not, our intention is not for new projects or for pilots.
Okay, we'll give folks another minute here or so. If you have a question, please post it. And I'll just mention again, so the recording of the webinar will be posted online. The email that's been available, it will continue to be available. So if you think of a question later, you can still submit the question through the email address. And Zinnia just had a question. I think I answered it, that you can continue to submit questions later through the email address. And you see that posted on the screen here. Health Access Prize at usaid.gov. Okay, last call for questions. Okay, so I think we're good. I'd like to thank our speakers, Caroline, Tara, and Meredith, for all the very helpful information. Just a reminder that the competition deadline, again, is June 28th. If you have additional questions, you can send them to the provided email address that you see on the screen there. We'll be posting a recording of this webinar on the prize portal. That'll be available in a few days. It takes a few days for us to process it and upload it. So this brings our webinar to a close, and I want to thank you for your participation. And if you wouldn't mind, we have a couple of poll questions that we would like to ask you to answer. One is about how useful you thought that the webinar was, and also if you wouldn't mind telling us if you plan to apply to the prize, that would also be very helpful for us. So thank you again for your participation. We very much appreciate it. and please answer the poll questions, and we'll be closing the webinar. Thank you.